part 3 of this mini 6-part series. I am your host today, Bonnie Jin. In the last segment, I interviewed the acupuncture expert, Dr. Jin, about how dry needling is a demeridian style of acupuncture. Today, I would like to continue the conversation and to focus more on the comparisons between acupoints and myofascial trigger points, MTRPs or TRPs. Dr. Jin, would you please introduce the concept of TRPs?
Trigger points are defined as hyper-irritable spots in taut bands of skeletal muscle fibers. The literature suggests dry needling is one of the several interventions to treat myofascial pain syndromes by stimulating trigger points, which is also known as intramuscular stimulation. Myofascial pain syndrome is a common diagnosis in patients with musculoskeletal pain associated with active and latent myofascial trigger points. An active trigger point has spontaneous pain or pain in response to movement, stretch, or compression, while a latent trigger point is a sensitive spot with pain or discomfort in response to compression only.
I know acupuncture is a therapy using needles to stimulate different spots, known as acupoints, that are lodged on various meridians or channels distributed all over the body based on the classical meridian system in Chinese medicine. Why do you say trigger points are just acupoints?
There is strong proof to demonstrate that the trigger points used by dry needling are just acupoints coined in ancient China. First, the essence of the trigger points is tender or painful points located in muscles and connective tissues. In other words, they are identified through tenderness or pain on palpation. In fact, one of the acupuncture's earliest forms of point selection. 2,000 years ago, a classical traditional Chinese medicine book, Huang Di Lei Jin, has mentioned the pain point, tender point, is acupuncture point, pronounced as Yi Tong Wei Su in Chinese. Later, one of the China's preeminent physicians, Sun Simiao, called these tender or painful points Shi points. In Chinese, Shi means oh yes. This is the same as in the West. When the tender or painful point is pressed, the patient feels unexpected pain and shouts, ouch.
I see. So in ancient China, similar phenomena have already been observed, just using different names to call trigger points. Are there any modern studies done to compare both types of locations?
Yes, a close correlation of the trigger points and acupoints locations has been observed by comparisons. In 1977, Merzak and colleagues found a remarkably high degree, like 71%, of correspondence between trigger points and acupuncture points. In a June 2000 review article, Hong and colleagues correlate the tender points to acupuncture's Shi points and the local twitch responses to acupuncture's TrP based on the works of the Merzak. According to the dossier comments, 92% of the 255 trigger points correspond to the acupuncture point.
I see. So those are the reasons for your points. You know, I've heard that even the formation mechanisms of trigger points and acupoints are similar. Dr. Jin, can you elaborate on that briefly?
Yes, there are two hypotheses on the formation mechanisms of trigger points put forward. The most credited local hypothesis for primary trigger points formation is first put forward by Simmons and so on, and later expanded by Guanyuan and colleagues. That suggests that the first phase of the trigger points formation consists of the development of the atoll band as a result of the abnormal interpret potential caused by excessive acetylcholine ACH release in the neuromuscular junction as the model interprets. EMG studies show this as spontaneous electric activity called SEA, also called interpret noise. Trigger points irritability can be objectively assessed with the prevalence or amplitude changes of SEA that are recorded in this region.
That is very deep insight.
It's a further hypothesis that due to this excess acetylcholine release as the model interpret, sustained sarcomere contractures occur that could lead to local ischemia and hypoxia. Consequently, vasoactive and ergogenic substances are released that can sensitize peripheral nociceptors called peripheral sensitization. Sustained peripheral nociceptive input might sensitize dorsal horn neurons and supraspinal structures, leading to hyperalgesia and allodynia, as well as referred pain. This is called central sensitization.
Dr. Jin, do you have any comments about the above formation mechanisms? How do they play an important role in the development of acupuncture?
All those belong to the modern studies on acupoints or acureflex points. Such studies like the development of the atoll band are very important for stimulation target of acupuncture because it relates directly to the mechanisms of needling responses, such as local twitch responses, called TrP in Chinese, which will be discussed during the next part of this series. Though using the abnormal interpret potential to explain the development of the atoll band may be not completely correct.
I heard you have proposed a theory called acureflex point acupuncture, or ARPA, to clarify the essence of classical meridians and acupoints, which can explain the formation of acupoints, including trigger points.
Yes, in recent years, so-called peripheral sensitization and central sensitization are considered as the primary mechanisms for the formation of the acupoints. The third band as the main manifestation of trigger points can be categorized one of the manifestations of the acureflex points.
What are acureflex points exactly? Can you briefly explain the manifestations of acureflex points and the relationship between trigger points and acureflex points?
The following are the various manifestations of the acureflex points. One is the sensitivity changes, like tender spots, the appearance of the tension of the local soft tissues, taut band, swollen or muscle atrophy, lower electrical resistance of the skin, or increased or reduced skin temperature.
So, it sounds like the manifestations of trigger points are just one form of manifestations exhibited by acureflex points.
Exactly. The following is the basic comparison between acureflex points and trigger points.
From this table, it's clear that trigger points are just one type of acureflex points.
Indeed, trigger points are just one type of somatic acureflex points. As shown in this picture, there are three types of acureflex points: somatic, visceral, and central acureflex points. Each of them can also be divided into two types: local and distal. Obviously, trigger points belong to the category of local acureflex points.
Very impressive. Thank you, Dr. Jin, and thank you everybody here for your attention. In today's interview, we learned that trigger points are just ashi points. In fact, trigger points are actually partially overlapping with acupoints. Acureflex points are a modern expression of acupoints, and trigger points is a type of somatic acureflex points. Therefore, dry needling based on stimulating trigger points using acupuncture needles is still a style of acupuncture. Stay tuned for our next episode, part 4. See you then, folks!
Thanks, Bonnie. Thanks, everybody here. See you next time.